Hello and welcome to Navigating Managed Medicaid. It is my absolute pleasure today to share with you some of the new developments within CHESS with our CIN for Medicaid and some of our exciting news and opportunities to enhance patient care delivery to your patient population. We'll start with just diving into the agenda. We're going to begin with an introduction of CHESS, a CHESS Medicaid CIN overview, delegated care management and provider support. We'll look at the advantages of joining a CIN, and then contracting next steps and handling any questions you may have. So who is CHESS? We are a health enablement company. We offer a full suite of services to support providers in care delivery and in success in value-based care. We have years of experience as a CIN within North Carolina, and we married that expertise as a CIN with expertise in Medicaid. And that's why we're here today to talk about the opportunity for a CIN Medicaid support. You can look here at the graph of North Carolina up on the right top of your screen and see that we've established quite a presence within North Carolina and are serving many patients across North Carolina. And then down below that, you can see many of the different value partners who've partnered with CHESS to have that enhanced care support delivery. So let's talk a little bit about why CHESS is different or how CHESS is different. CHESS has really cultivated an all-payer solution. Like I mentioned, years of experience as a CIN. We have the ability and expertise within Medicare, Medicare Advantage, Medicaid, and commercial. And so that makes us a little unique within the market. We have a comprehensive approach. So our approach goes way beyond just a technology support or a care management solution. We do include technology. We offer contracting support. We do offer care management. We have other multidisciplinary support built into the programs. And so it really is that comprehensive suite of services that we're able to provide. And then access to actionable data. With years of experience in the field, we've really our team has mastered the ability to pull what data sources we have, to tee them up to inform clinical care and clinical decisions and to drive outcomes for patients. And I'm excited to talk to you a little bit more about that as we move through this presentation. So CINs can generate so much value for you, the provider, and for your patients. And within a CIN, care is coordinated to improve quality, to control costs, to reduce disparities, and to drive patient-centered outcomes. And all of this is empowered by that data strategy and analytics. And I am pleased to announce that the CHESS Medicaid CIN did launch on April 1st. We are up and running, supporting patients, and we are contracting with all 5 PHPs within the state. And joining our CIN is easy. We'll get to that at the end of the presentation, but you can continuously add into the CIN. There's not like a certain time requirement of when you jump in and receive our support and services. And we'll talk a little bit about how to do that at the end of the presentation. So since inception, CHESS as a provider-led organization has prioritized provider relationships. We seek to be an extension of your team and partner with you for better patient outcomes. And as you see here, CHESS will own the responsibility of the work while you keep focused on providing great care for your patients, and they benefit from the enhanced care coordination services and support. So let's look here at all that CHESS will own for you and then the single responsibility you as a provider have. So CHESS will negotiate and hold the payer contracts. We will provide the AMH Tier 3 care management for the contract. We'll manage all patients within that population support from a population health model, and we'll document the required care plans and the comprehensive health assessments. and tee those up for visibility for you as the provider. We will help manage the provider panel and roster management. We will participate in the provider portals, the verification, and any of the auditing and submission of the quality requirements through those portals as allowed. We'll do full completion of the delegation audits, and if you've ever participated in those, you know what a value that is, that we'll do that on your behalf and you don't have to worry about it. We manage the payer relationships and requirements. So when you multiply this across the 5 PHPs, that's quite a lot of meetings and quite a lot of data points and resources that you don't have to worry about kind of trying to wrap your hands around. Our team will manage and leverage those relationships for you. We'll attend all the payer meetings and the JOCs, and then we package that information up into a simple to digest, easy to understand message for you, the provider, to be transparent in the care that we're providing to your patients, how we're doing, how we're succeeding within those contracts, or opportunities to improve our success. We'll bring that back to you in kind of a monthly operations meeting, where we truly partner with you to change these outcomes for patients. So all this work will magically be happening in the background, but you will not be unaware of it. We'll make sure that we're informing you of all the great things happening on your behalf and the patient outcomes that we're having. So let's look a little bit about the CHESS care management approach. This is my area of expertise, and I always get so excited to talk about the way we support your teams. We do offer that full AMH Tier 3 delegation model, which includes high-risk care management, chronic disease support. It facilitates transitions, screenings, wellness, prevention, really trying to surveil the population and understand what their needs are and intervene on those opportunities. Like we mentioned in the previous slide, all of our work then supports that quality performance, and it maximizes the opportunity for those potential quality bonuses that are built and baked into the contracts. We pride ourselves in being high touch collaboration. We see ourselves as an extension of your team. We have the capabilities of documenting and scheduling within your EMR. We seek to be very transparent. We truly see this as a partnership, to where we partner with you to enhance the care delivery to your patient population. And it is that data-driven care and support using kind of our CHESS population health platform, our risk stratification algorithm, and we'll jump in to looking at a little bit deeper dive into what that looks like. So the one thing that I often hear within Medicaid is that there are issues with data quality and data timeliness. And one of the things that we've been able to leverage in our expertise with CIN is really a mastery of the data and how to tee and serve that data up, how to maximize the opportunities with the data. And so CHESS has then built enhanced risk stratification that we layer on to the PHP risk scores to really understand what the population needs and opportunities are. Our risk stratification identifies more patients that are falling into that rising risk, where we're able to intervene sooner and get ahead of some of those health outcomes that we want to drive within your patient population. It is real-time data to improve patient care. Our strategies populate daily so that we know what patient needs what level of support at that point in time. And we can really optimize then our performance by doing that more sophisticated analysis of data, really understanding what are the trends in spend and the trends in utilization, and how are we tracking towards quality and gap performance, and really helping to unpack those opportunities for you as a practice or for the patient at the individual level that we're working with that patient. And then we've got a consistent reporting cadence, so you'll get a reporting package from us monthly. And then we have a really desire to kind of be transparent with our partnership and support. And so in those monthly operation meetings, we'll be reviewing any information that needs to be brought to you from those payer meetings. We'll be reviewing performance within those contracts. We'll be demonstrating to you the touch and support and the outreach that we've layered across your population to support your patients, and looking at our reach rates and our penetration rates and how we're tracking towards some of those major milestones that we're trying to achieve within your population. And we've already kind of talked about and highlighted how we offer those wraparound services, to where we really are an extension of your team, and we really are sharing the resources. We'll have flyers that we can post in your office. We will call on behalf of you, the provider. We can document within your EMR. We really identify ourselves as a part of your team, not sit kind of outside as a third party. We really try to integrate with you and understand how you offer care to your patient population. So we have highlighted that our model of end-to-end operational support allows you to prioritize and focus on patient care. Our curated expertise, both at the CIN and in Medicaid, has a proven track record, and our Medicaid team boasts a 100% passing rate on audits, continually meets or exceeds our service level agreements. Our sophisticated analytics and transparent reporting drive enhanced clinical support that does yield both clinical and financial value. Our collaborative partnerships and approach is the secret to our success. So let's look next at a testimony from one of our value partners.
We began several years ago. Actually, when I very first came to Northern as a new employee, I was the ACO Care Coordinator, was my first title here, which has changed over the years. But we had experience with another ACO that we were in for probably 2 years before we elected not to continue. We felt like we weren't getting a lot of good information or data that was relevant to our population of patients. And so we severed that relationship and then had a year on our own doing our own value-based care, and which you can imagine was difficult. Difficult for many reasons, but mostly because it's hard to aggregate all of the data that you need to really know who needs care and what care they need. And so we entered into a relationship with Chess, and one of the big selling points with Chess was that they were local, so it was easy to interface personally with people from the organization. There was a really strong focus on provider perspective, which I had not experienced before in value-based care, which I think was really enticing because the providers are a key component to really executing value-based care well. And then really we've been so happy with the data component because for a small organization like ours, that is trying. I mean, there is a lot of work that goes into aggregating that data, knowing who your patients are, maintaining rosters, submissions, all of those kinds of things are trying for a small organization to do on their own. So at this point, we've been really pleased with our entrance into value-based care. And I think the other, probably the most important piece is it's allowed us to separate, separate somewhat from the data piece and focus on patients. Because Chess is helping us with that data piece. They're sending us reporting that we can act from, and so we can really spend the most of our time and energy working with patients and what those patient needs are.
So I think Emily did a great job of kind of pulling everything we've discussed in our time together into one kind of cohesive thought for our Medicaid CIN and how we are able to support you as an organization. Here we've got next steps. Hopefully something we've said today has piqued your curiosity, and you'd like to have the opportunity to ask more questions, to meet with us, Like we said, we truly view this as a partnership, so we'd like to do a deeper dive, understand your needs as a provider and a practice, understand the needs of your patient population, have the opportunity to talk further about our model and our contracting and kind of our mode of operation. And so to do that, there's a QR code here on the right of the screen, and that will help you contact Christina Wright, who is in business development for Chess. And she would reach out to you then and follow up and set the appropriate meetings, demos of our platform, and give us the opportunity to really understand how we can best support you and move forward. Thank you so much for your time today. I really honor and value that time, and we're really excited about the opportunities of the way we can partner with you and improve and enhance your patient outcomes. Thank you.